The deeper we get into the pandemic, the more we learn about the disease. And while many patients have had mild cases that seem to resolve relatively quickly, others tell stories of symptoms that they're experiencing months after they've been diagnosed. And here to talk more about that with us is Dr. Jaimie Meyer. She's an infectious disease specialist at Yale Medicine and an assistant professor at the Yale School of Medicine. Good morning, doctor. Thanks for joining us.
Good morning. Thanks for having me.
So there are several Facebook groups for COVID-19 patients, survivors, as well as for family and friends of people who've died due to the virus. We've been looking at some posts on a page called Survivor Corps. It seems like many people diagnosed see and feel long-lasting effects and symptoms. So we would like to know why that's happening.
Right. So I think it's something that we don't really understand well yet. We know that most people who have symptoms with COVID-19 only have symptoms for 10 to 14 days. But I know that there are reports coming out, like you said, from people who have recovered from the virus and are still experiencing really a wide range of symptoms. I think we don't really understand it yet, in part because while we sort of feel like we've been living with this virus forever, it's really been less than 6 months. And so there is concern about it, but I think it requires further study.
Okay, so it sounds like a lot of those physical symptoms seem to be holding on for certain patients, but how might this be taking a toll on people emotionally or mentally?
Yeah, so certainly the physical symptoms seem to be holding on for a while, and they seem consistent with something that's called in medical jargon myalgic encephalomyelitis or chronic fatigue syndrome. Basically, it's seen with other viruses as well. Where people are experiencing physical symptoms for a long time. Those physical symptoms can be so debilitating that alone can take a toll on people emotionally. And that emotional experience on top of the collective trauma that really all of us have experienced through this pandemic can be very debilitating.
I bet. So we were looking at some of those posts on that Facebook group, people saying that they've got symptoms for 15 weeks or longer. Some people say that they feel 100% better, only to have those symptoms return. Is there a course of action or treatment? Are we seeing this here locally?
So not that I know of in terms of people reporting it locally, but that might be because people are at home suffering alone, which would be a horrible thing. People need to know that they should reach out to their physician and talk about it. I think, first of all, you want to make sure that there's nothing else that's potentially driving these symptoms, which is just really and get help about this. But like I said, this might be something related to the virus itself and really ongoing inflammation related to the virus itself. That was something that was observed quite commonly after SARS, which was a very similar virus to this one.
Okay, so obviously something that we have to continue researching and learning more about as this pandemic continues. Dr. Jaimie Meyer from Yale Medicine, thank you so much for your time today. We appreciate it.
Thanks for having me.